Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, November the 30th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen De Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. We are 10 months into our fight against COVID-19, and I know that it is really wearing on everyone, like really wearing. But we're going to get through this. I'm confident of that because we continue to follow the advice of our public health professionals. I know it's easy to get dismayed by the daily numbers, particularly the ones that Dr. De Villa will outline today, but it won't be the first time. We know it takes time for the numbers, once they get headed in the wrong direction, to get back on track and eventually head in the right direction. We have taken unprecedented steps based on public health advice to stop the spread of this virus, and now is the time when we have to heed that advice in order to save lives and to protect the health of our loved ones, our co-workers, our friends, our neighbours, our classmates, and to protect the healthcare system and ultimately to protect the economy because, as we know, a healthy economy requires healthy people. We will get through this lockdown and we will reopen again. Right now, we know it's an incredibly difficult time, especially for the majority of small independent businesses. We know, and Chief Pegg will detail, how the vast majority of these businesses, especially restaurants, but not confined to restaurants, are doing the right thing. They are following the provincial regulations and they are shifting their businesses wherever they can to takeout or to delivery or to curbside pickup to help stop the spread of COVID-19. Their actions and their sacrifice will make a difference and will help us to ensure that we will have a healthy economy again, a healthy economy with the healthy people necessary to make it go. So as people do their holiday shopping, I once again encourage you to please shop online with local stores or shop in a way that allows you to take advantage of curbside pickup. I was very heartened to see quite a bit of curbside pickup activity on Bloor Street and Queen Street on the weekend. As shoppers, you are able to make the decision to go online and to shop local, to get retailers even to send you a picture of something that you can then buy or pick up at curbside. Never has it been easier to do this, to actually trade a picture back and forth of different things, or to go online and make a purchase and thus support a small independent business. And never has it been more important to shop local and to shop independent. Think of the fact that 40% of these smaller independent businesses make all of their sales for the whole year during holiday time. And that will give you a sense of how make or break this time of year is for them. Think of the sports and community organizations that they sponsor year in and year out, and all that they add to the stability and to the quality of our neighborhoods right across the city. This week, please plan right now, it's Monday, please plan to take part on Wednesday in Takeout Wednesday so as to support your local restaurants. Many, if not most of them, are allowing food to be delivered or to be taken out, and this again will support the staff they've kept on with help from the governments and help them to stay in business. Each and every order that you place with a local restaurant will help. We moved late last week to help with curbside pickup at many locations by reopening the registration for our Curb TO program. This creates temporary parking pickup zones outside Main Street businesses and allows you to park there for a period of 10 minutes while you go to pick up food or to pick up an item that you might have purchased through one of these retailers. The city received dozens of Curb TO pickup zone applications over this past weekend, and we will continue to receive and review them as quickly as possible. A reminder that you go to toronto.ca/curbto to make application. Staff are aiming to help as many small Main Street businesses as possible with new pickup zones and are already working with business operators and BIAs to install the first new pickup zones on an urgent basis. There were quite a few that were still in existence from the previous round earlier this year. This is one of the ways the city government is working to help businesses get through this tough time, along with the advocacy to the other governments, which was a help in getting them to provide programs of support for rent and for wages for these smaller independent businesses, and programs of our own like Digital Main Street, which has literally helped thousands of businesses get online and establish a meaningful e-commerce presence since the beginning of the pandemic at no cost to them. Our work to provide city spaces for COVID-19 to help provide the province and community health partners with testing sites is also continuing. Parks, Forestry and Recreation of the City of Toronto has arranged 140 assessment centre dates in city facilities close to home for the people that need to get tested. 82 of these dates are still upcoming, so people can get tested in their own communities on an accessible basis. City staff continue to work on this issue so that we can provide space where it makes sense and keeping our role as to help ramp up the overall provincial testing effort, which must continue to provide more testing and more accessible testing to those who need it the most where it is needed the most. Today, the Greater Toronto and Hamilton area mayors and chairs also met for our weekly meeting about the ongoing response to COVID-19. We spoke out today with a united voice to encourage all residents across the region to please stay home as much as possible right now, to avoid region hopping in any direction, from one region to another, no matter what the status of those regions is, and that, of course, will make it easier to shop local because you're staying home. We were also once again united in asking the federal and provincial governments to take action to ensure that no one will lose a job or a paycheck because they get tested and test positive for COVID-19. We actually have people today who are going to work sick because they're afraid of losing their job or their paycheck. And when they go to work sick, they're infecting other people. This is not an acceptable state of affairs. Neither government has yet responded to the unanimous statement of concern on this that we made last week as mayors and chairs representing millions of people in this region. We look forward to their response. I'll now ask Dr. Davila to offer her report for the day.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 643 new cases of COVID-19. There are 249 people in Toronto in hospital with COVID-19, and 48 are in the ICU. What the numbers tell us is more important than what the numbers add up to. 643. It's a big number, the highest I have reported to you. And it is something to think about very carefully. But I also want you to think about it in context. First, remember that case counts fluctuate. Last Monday, we reported 331 new COVID-19 cases. Over the last week, case counts have fluctuated from that low of 331 up to today's 643, but generally in a range between the high 400s and the mid 500s. The case counts are concerning in any measure, but quite variable from day to day. Second, the virus takes time to incubate, and symptoms take time to emerge. The infections we're seeing lately occurred now a week or even 2 weeks ago. The provincial restrictions, the gray zone designation in which Toronto now operates, has only been in place for 1 week. The restrictions are in the early stages. Contact between people has only just been reduced as a result of the measures. And certainly we know that keeping distance is effective. We've seen the positive outcomes of distancing measures many times in many places, including right here in Toronto. Time is needed to get a full picture as the new measures take effect. Finally, testing also plays a part in case counts, and we know that in the last couple of days, there have been around 55,000 tests per day completed. So this is bound to capture a higher number of infections, given the extent to which COVID-19 is spreading here in Toronto. This context brings us to what, for me, is the most important point. Please keep your guard up. I hope it does not take a high number like the one we have today to make that point resonate. I would far rather that people reflect briefly on today as one sobering number, but draw from it a renewed commitment to keeping our collective guard up. By making smart choices about where we go, who we see, and what we do, and by renewing our commitment to doing all we can to limit the spread of the virus, we can prevent infections. Distance works. Masks work. Hand washing works. Staying apart works. We are at lowest risk in our own homes with the people we live with every day. And for the foreseeable future, those are the people we should see the most, for our protection and for everybody else's. High case counts are in large part under our own control. By the same token, so is getting our case counts down. I know there is a real awareness of what we can do on an individual basis to play our part, as I know many, many people are doing. And I'm confident that we are going to see good results if we all do just that. I'll now hand it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. Davila, and good afternoon. Before I begin my formal remarks this afternoon, I would like to extend my sincere condolences to the family, the friends, and all those impacted by the fatal fire on Cavell Road in Etobicoke this morning. Our fire investigations team is fully engaged, working alongside Toronto Police and the Ontario Office of the Fire Marshal in order to determine the origin and cause of the fire, as well as the circumstances contributing to this tragic loss of life. On behalf of all of us, I extend condolences on this tragic loss. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. Our coordinated COVID-19 enforcement team, including Toronto Police, municipal law enforcement officers, and Toronto Public Health enforcement officers, have been working tirelessly for the past 9 months, enforcing the regulations relating to COVID-19. This includes proactive inspections, responding to complaints, educating the public when necessary, issuing tickets, and laying charges against those businesses and individuals found to be in violation of the law. The City has taken formal enforcement action 1,660 times to date in response to COVID-19. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. 130 bars and restaurants were inspected this weekend, resulting in a 98.5% compliance rate. Only 2 were found to be non-compliant over the course of the weekend, with action being taken by the investigating officers. We also received a number of complaints related to non-essential businesses. In response to these complaints and following inspection by our enforcement teams, 16 charges were laid in response to violations of the Reopening Ontario Act. This included a number of different types of non-essential businesses, including hair salons, restaurants, and furniture stores. Our enforcement teams were busy with proactive inspections of malls, and I'm pleased to report that no issues were identified, as each mall was found to be operating in compliance with the Act, and that included operations on Black Friday. In response to complaints relating to gatherings on private property over the weekend, 1 charge was laid by Toronto Police under the Reopening Ontario Act. We also continued to respond to issues in Toronto parks. Approximately 15 bonfires were extinguished on the waterfront, including 2 that were left unattended. One of these large bonfires in Prince of Wales Park in South Etobicoke required response by Toronto Fire Services. I want to thank the vast majority of residents and businesses who continue to do the right thing to help stop the spread of COVID-19, to save lives, prevent the transmission of COVID-19, and prevent the healthcare system from becoming overwhelmed. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, just a reminder, you will need to unmute yourself from WebEx to ask a question. We also have a number of staff on the line for any specific questions you may have, including the Toronto Police Service. First question is to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thanks so much. My first question is for Dr. Davila. It's regarding the outbreak at Swansea Junior and Senior Public School. Has Toronto Public Health identified the source of the outbreak? We heard it may have come from a kid's birthday party or a party in general, because if it did, these are junior and senior elementary school kids, so their parents would have had to organize the party. And if that's the case, are charges going to be laid against the parents?
So, Haley, as you can well imagine, there are active investigations happening at a number of schools, and those investigations continue in order that we can protect the health of children and our school communities. When it comes to Swansea, my understanding is that there are a relatively small number of cases within the school, and that there is very little that demonstrates transmission within the school. And in fact, what we are seeing is cases that are associated with cases from their own household, rather than being linked to specific events in the community. Of course, we are concerned, and I think it's really important that people really focus on the advice to stay home as much as possible and to limit their contacts to the greatest extent possible to those with whom they live. And that would certainly include avoiding birthday parties or other social gatherings. As difficult as this is, it is, just for now, while we are living with COVID-19, and we look forward to being able to celebrating birthdays at some point in the future when this is finally behind us.
Thank you. And my follow-up question is for Mayor Tory, and it's regarding all the money the city has lost this year in parking because no one's really been out and about. The Parking Authority Board now says it needs to find ways to make up for the lost revenue. Councillor Brad Bradford says the city may have to look at areas where free parking is offered and implement a fee. So would there be a public messaging campaign ahead of those changes? And also, do you foresee any layoffs because of this or parking rates being increased?
Well, first of all, there's been no decision taken to do anything about the revenue shortfall by way of change in policy or change in the nature of parking spaces. The councillor is a member of the board and was talking about his own views as to one option that might be pursued, but there's been no decision taken on that. Secondly, we have had the good fortune to receive some assistance from the other governments with respect to lost revenue generally, whether it's from transit or from parking or from land transfer tax revenue, and that's what has helped us to avoid cutting services or dramatically increasing taxes. We'll obviously have to take a look overall at changing parking patterns and at the particular impact of the pandemic and decide what we're going to do about that, because the dividend coming from the Parking Authority was very important to us in the context of providing city services, but that examination is not complete, and we'll report to the public as soon as it is.
Okay, thank you. We'll go next to Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. Mayor Tory, you were speaking about your disappointment from not hearing back from either government regarding those paid supports that you would like to see. The number of people asking for paid sick leave continues to grow. Can you just maybe delve in a little bit more as to what those discussions have been like and your urging to them and who you've been speaking with, and also just really what is at stake the longer you have to wait for them to come through with this?
What is at stake here is something actually very simple, which is that people are going to work sick because they're afraid they're going to lose their paycheck. And when they go to work sick, if they have COVID-19, among other illnesses they might have, they're going to spread that to other people at work when they should be staying home. And they need to know that during the 14 days of mandatory isolation, if you are COVID positive, that somebody's going to look after their paycheck. The simplest way to do that would be to have them qualify under the existing federal programs that I think are called the Emergency Employment Benefit. There are probably other ways to do it, including some of the big private sector companies that employ these people stepping up and saying, for the sake of 2 weeks and for the sake of the number of people who will be found to test positive, which we know is a relatively small percentage of those who get tested, that we're going to backstop these people. But the notion we should just let them continue to go to work and spread this to other people because they're afraid of losing their job or their paycheck is ridiculous. The response from the other governments so far has been polite in terms of hearing the recommendations made by the city first and then by all the mayors second and undoubtedly by other groups we've seen out there. But, you know, polite responses, we're past time for polite responses. We need somebody to act now. They should sort it out as between the two governments and the private sector. Municipalities clearly not being in a position to be able to do this. Who's going to act and act soon?
And just my follow-up is for both you and Chief Pegg. With the number of parties, I know there was really only one charge over this weekend, but we've seen some pretty outlandish things in the past couple of weeks with people partying and storage units, but also we did see over the weekend that there were parties in, or at least one significant one, in an Airbnb. Just based on this and the lengths people will go through, is it time to maybe think about, I don't know, maybe putting a pause on short-term rentals just to take that ability away from people?
I will only say that the existing regulations, the new ones put in place actually, and the practices of these companies, these short-term rental companies, they've actually, in effect, ruled out these parties in many, many cases. And I should point out that of the substantial number of complaints received by the city, mostly, I guess, through 311 or calling the police over the weekend, by the time the authorities arrived, some of them turned out to be, you know, gatherings that weren't as big as had been reported or people had dispersed and whatnot. But the bottom line is people are reporting these, people are going out. But I think the regulations with respect to Airbnb and the practices of those companies are fairly clear in saying they are not to be used for that purpose. And maybe Chief Pegg would like to elaborate.
Yeah, the only thing I can really add, Mayor Tory's covered this really well, is the enforcement, our coordinated enforcement teams are of course focused on enforcing and responding to complaints relating to alleged violations of the Reopening Ontario Act and the various COVID-19 related regulations and laws. So should there be policy changes made with respect to short-term rentals, it's not really material to the work that's being done initially by our enforcement teams. Of course, if those changes were made, we'll respond to them in time. But Matt, as you know, we're responding both proactively. Our teams are connected and coordinated. We're responding on a complaint basis, and like Mayor Tory aptly reported, I'm pleased with the fact that the number of violations that were determined this weekend and the number of charges that were required to be laid was relatively low, and I think that's good news.
Okay, thank you, Chief. We'll go next to John Chidley-Hill from the Canadian Press. Go ahead, John.
Good afternoon, everyone. This question's for Dr. Davila. I was curious, how concerned are you about the outbreak at Thorncliffe Park Public School and the high positivity rates in that neighborhood in general?
So I think we're concerned, understandably, as the local public health department about high positivity rates in any of our communities. And we know that the greatest risk for schools anywhere in our community is the surrounding rate, what is actually happening in the community in which that school is situated. So in having discussions with the team at Toronto Public Health who's more directly engaged in the investigation and the assessment of the circumstances at Thorncliffe, they are certainly working very closely with the school partners. We know that there has been some good, pilot testing that was done at that particular school, which is how we know what the positivity rate is at the school. And as it turns out, the positivity rate for COVID-19 at the school is in fact lower than that which is happening in the community. I think the other element that's important to pull from that particular assessment and investigation is that based on the investigation that's happened to date at the school, there is really not much evidence that suggests ongoing transmission in the school. And on the contrary, what we are seeing is transmission within the community, high rates within the community, and therefore, not surprisingly, high rates amongst children who are part of that community and attending that particular school. What this all comes down to, again, is the advice that we have been proffering for several months now, that as much as possible, keep your distance where possible. We're asking people throughout the entire community to, stay home as much as possible, to do as much as possible in a remote fashion or a virtual fashion, wherever that is something that can be done. To keep those contacts exclusively to those, wherever possible, to those with whom you live. Wear your mask as much as possible if you're outside your home. Wash your hands. Stay home if you're sick. This is the kind of action that we need each and every person in our community to take on, and that's the kind of action that will actually bring down community spread and the incidence of infection within our schools.
As a follow-up, as more voluntary testing is done at publicly funded schools in Toronto, do you think that we'll see more asymptomatic cases like we did at Thorncliffe Park?
So I think, a simple maxim of testing is that if you seek, you will find. And yes, in some of those cases, we will expect to see asymptomatic infections. This is the kind of thing that we have seen throughout this pandemic, and that's not exclusive to Toronto. In fact, we hear reports from all around the province and indeed all around the world of exactly that. But it still comes down to what we can do, each and every one of us as a member of this community, to reduce the likelihood of spread. And at this point in time, it comes down to, watching your distance, wearing your mask, washing your hands, and as much as possible, making sure that you're staying home and getting tested should you develop symptoms of infection.
Okay, thank you. We'll go next to Nick Boisvert from CBC News. Nick, go ahead.
Hi, everyone. For Dr. Davila, given that aerosol transmission has now been recognized as a risk when it comes to COVID, do you think it's safe that there are still people sleeping in shared spaces in some Toronto shelters?
So I think that we are increasingly understanding more and more about transmission of COVID-19. However, we also know that while there is a certain amount of aerosol transmission, as you describe, it is relatively limited, and still the major route of transmission is close contact, direct contact with the respiratory droplets of somebody who has a COVID-19 infection. So yes, the possibility exists, but again, it is relatively small, and we know that most infection comes from that direct close contact with somebody who has an infection, and particularly in those circumstances where that close contact is prolonged and without a mask and without that sufficient distancing to allow for protection for individuals around. So I think that at this point, we just have to apply really good infection prevention and control standards, use the knowledge we have available to us, and I know that, through our partners and the work that we're doing at Toronto Public Health, this is exactly the kind of behavior that I've seen thus far.
Okay, and I want to ask a bit about some of those measures, and maybe to Marianne Bedard as well, because we've heard from some engineering professors and other types of experts who have said that there are things that could be done to mitigate some of those airborne transmission kinds of risks. So is there more that you feel the city could be doing in some of these congregate shelters to at least reduce that risk?
Go ahead,
So why
Marianne.
don't- if you want, I can start and then
Sure,
hand
go
it
ahead,
over
Doctor.
to Marianne, and she can speak in greater detail. But certainly I know that my colleagues at, including Ms. Bedard at Shelter Support and Housing Administration have, in advance of this fall, had consultations with some experts exactly in this area to understand, look, what are the appropriate infection prevention and control measures that can be taken within the context of shelters, ensuring the safety to the greatest extent possible of those who are residents and users of those shelters, and as well for staff. But perhaps Marianne can speak to that in greater detail.
Thank you, Doctor. Yes, I mean, we have been taking infection prevention and control measures since the beginning of the pandemic, and we've had relative success in the shelter system. The level of contagion in the shelter system is dramatically less than many other congregate settings, and that continues. We've also, developed very comprehensive testing and isolation and recovery protocols as well for this population. So, we are able to keep any spread to a minimum. So we have a system to transport people to testing, to transport them to an isolation site while they're waiting for their test results, and a hotel for them to recover should they be infected. So, right across the shelter system, people take this very seriously. This is a population that is vulnerable to a respiratory infection, and people have been working, very, very hard for many months to make sure that the impact of COVID-19 in the shelter system has remained as low as it continues to be.
Okay, thank you, Marianne. We'll go next to Sean Leathong from CTV News. Sean, go ahead, please.
Hi, good afternoon. This question is for Dr. Davila. I want to return to Thorncliffe Park Public School. Based on the news that there had been so many people or so many children who were asymptomatic, what would you say to those, who perhaps may become fearful that because so many asymptomatic cases are popping up, that they could be afraid that this is in fact driving the pandemic within the city, that there may be so many cases that go undocumented?
So I think that's certainly an interesting question, and one that I'm sure many of us are asking, all around the world. And we have known that there has been an element of infections that are spread largely asymptomatically. It's interesting, though, when I've spoken to clinicians who have the opportunity to interact more directly with those individuals, in virtually every case that I can think of, in every interaction that I've had with those clinicians who've had that opportunity to interact with patients, they tell me that in fact, when you really probe into the circumstances, many of these infections are not quite as asymptomatic as they appear to be or as they're first reported. That when you really start to examine what the nature of the clinical experience is, that a number of people do in fact have symptoms, perhaps relatively mild, but again, still with symptoms. I think what this tells us, though, is that it still comes down to those basics that we have said over and over and over again. Because regardless of whether one has symptoms or not, to the extent that we can use physical distancing, right, to the extent that we are each able to watch our distance as much as possible, we know that that makes a difference. We also know that masks work. We know that hand washing makes a difference. We know that staying apart makes a difference, maintaining that physical distance. And we know that certainly if you do develop symptoms, that staying apart from other people and getting yourself tested, as quickly as possible. These are the kinds of actions that taken together can work and have worked to control the spread of COVID-19.
Okay, a quick follow-up. Do the numbers out of the school today change what would be considered a threshold for closing a school down? Because obviously we've had situations where, schools have closed down with a lower number of cases.
Yeah, so I think you bring up a very good point. Certainly knowing the numbers of cases within schools is one important element of the assessment. But perhaps even more important than that is understanding, is there evidence of transmission within the context of the school? You can well imagine with a number of our schools that they're quite large, and you may have cases within a school with really no evidence of ongoing transmission. You add that to the fact that there are very significant benefits to actually having our children attend in-person school, and taken all together, that's what we're thinking about in concert with our school partners and our school board partners as we seek to make the best decisions and provide the best advice to our schools, the school board partners, and the students and families in any one given school community. We really are, as with every decision that has been taken throughout this pandemic, weighing out all the different options, trying to make sure that we're achieving the best balance between mitigating risks and managing risks, while at the same time maximizing whatever benefits are important and that we're seeking to ensure are being maximized.
Okay, thank you. Final question is to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. First question for Dr. Davila. You talked a little bit about the big number today and why I guess maybe we shouldn't be so concerned, but people are going to see a record number of new infections after 1 week into a renewed lockdown. Can you elaborate a little bit more on what we're seeing as far as what we can tell about the cause or the location or the kind of behaviors of the new infections? And when will we know if the actions you and the mayor and the province have taken are actually working?
So a couple of things. Certainly any new cases that we're reporting today are just starting to be investigated, and that does take some time. What we do know, though, over the course of the pandemic is that the consistent feature in the vast majority of the new infections that are reported on any given day arise from close contact. That's why you hear me say over and over again the notion of keeping our collective guard up. We know that it is in these close contact circumstances where people are more prone to let their guard down with people that they know, that they have close contact with. These are the circumstances that give rise to the, most of our infections as we're seeing them. So that's why we continue to really try to hit home that message on watching that distance, wearing masks where distance can't be maintained, and washing hands, and of course staying home when you're sick. So I think that these are the kinds of things that we are really seeing in our data. And certainly when we look at what is happening now, or the cases that we're reporting today, it will take us some time to do the investigations and make specific determinations as to what gave rise to today's 600 plus cases. And when it comes to thinking about when might we expect to see the more fulsome impact of any changes to restrictions being placed in, the gray zone, as it were, of the provincial framework, I think you want to wait for at least one incubation period of the virus, and we're talking 14 days at a minimum. It does take some time to see these changes, and that we know not only from our own experiences throughout the course of the pandemic, but in fact what we've seen from other jurisdictions as well.
Thank you. And a follow-up is for Mayor Tory, and it's on a non-COVID topic. Mayor, there was a home in Mimico that was knocked down on the weekend. It was supposed to be coming up a possible heritage status for it at a meeting on Monday, and it appears that the owner knew that and kind of rushed to get ahead with it. We've seen other cases of this happening at the Stollery and BMO on Yonge, which is the Beaux-Arts building, and then we have this new one. Do you think something has to change to try and stop owners from trying to get ahead of heritage and designation and just smashing the building down?
I think it's really regrettable that when the owner in this case would have known there was a preservation board meeting today, that steps were then taken to tear the building down before a proper due course hearing would have taken place to examine the merits of all of this. And I'm not suggesting anything illegal was done, because indeed the person in question got the papers, but I think it does explain why the city staff have gone about listing increased numbers of properties so as to at least allow for, when that listing takes place, a notice period that has to be provided if the owner wants to do something with the property. Because I think right now a situation where people almost in the dark of night can go and tear down buildings when there are pending proceedings in that regard it really can't be seen as very workable or respectful. So I think we have to do better, and I think that some of the steps being taken by the planning department will assist with that, but I'm not sure the system has been streamlined and made effective to the degree it needs to, so that you can have careful consideration of these things.
Okay, that concludes today's briefing. Thank you for joining us, everybody. We'll be back here on Wednesday. Please stay well.